My name is Susan Scott. I am the Business Community Coordinator for the Thompson School District. And we have a whole lot of folks that helped organize this event that are all volunteers from different organizations that come together to promote healthcare in Northern Colorado. I am going to give you a little bit of information about the NOCO Health Sector Partnership, and then I will start by having folks introduce themselves. Welcome to the very first NOCO Healthcare Careers Live Virtual Chat. Our focus today is on in-demand careers in Northern Colorado. This event is hosted by the Northern Colorado Health Sector Partnership, which brings together key stakeholders to promote and improve health within our communities. With industry at the forefront, we collaborate with education, workforce development, economic development, and other community partners to seize opportunities, respond to the changing healthcare environment, solve collective problems, and celebrate successes in our region. And with introductions, I'm going to start off with having our chat moderator introduce herself, Michelle.
Good afternoon, everybody. My name is Michelle Smith, and I serve as the Career and Tech Ed Coordinator for the Weldari 4 School District in Windsor and Severance. And if you have any questions throughout the presentation, please feel free to go ahead and enter those into the chat box. I'll be monitoring those and putting those questions out to the participants as we go.
Great. Thank you. And we'll start with our panelists to have them share who they are. I'm going to start with Jordan. Do you want to introduce who you are, where you are employed, and what your role is in that organization?
Hello, my name is Jordan Barrett. I am a CNA preceptor at Columbine's LeMay Avenue.
Okay, great.
CNA apprenticeship program, which is through my high school and Columbine.
And Jordan, what high school are you at?
I go to Rocky Mountain High School.
Great. Thank you. Desiree.
Hello, my name is Desiree. I work at Salute Family Health Centers here in Brighton, Colorado, and I'm a medical assistant.
Wonderful. Joyce.
Hi, everybody. Jordan and I are sharing a screen today. So I am the HR director at Columbine Health Systems, and I'm also the point person for the CNA apprenticeship program that we run at Columbine Health Systems on an annual basis. So my contact information will be available at the end of the session, I think.
Great. Angie.
Hi, everyone. I'm Angie Peach. I am the Medical Assisting and Phlebotomy Program Director at Front Range Community College.
Wonderful. Thank you for being here. And last but not least, Terry.
Hi, thank you. Which Carrie are you looking
at?
Oh, Terry.
Sorry about that.
Thank you, Susan. I'm Terry Brogdon with Salute Family Health Centers. I'm the Education and Training Director, and I'm also Business Development Lead for NEMA, the National Institute for Medical Assistant Advancement.
Wonderful. So all of you audience members can see that we have quite a variety of folks here to talk to you about some really in-demand careers that are right here in Northern Colorado. And we're going to get started with asking some questions of our panel related to their position. So I'm just going to get started, and please feel free, like we mentioned, just to type in questions in the chat and we'll bring those up as we go along. For all of our panelists, I would like you to talk about what certifications or degrees that you hold and where you completed your training or degree. And we'll just get started with, we'll go back with Jordan. I know you're kind of in the middle of earning some of those certifications, so go ahead, Jordan.
So yeah, I earned my CNA certification through Columbine, probably around the end of last year. I'm my senior year in high school, so I'd say the CNA certification is the only degree or certification that I hold right now.
Okay. Great. Desiree.
So I hold a certificate for my medical assistant. I'm a clinically certified medical assistant, and I got it through NEMA with Salute. And then I also just recently got my IV certification too as well.
Desiree, would you talk a little bit about how long those certifications took you to earn?
So for NEMA, I believe it was 7 months program, and then so you get trained to do vitals, do phlebotomy, everything, and then for my IV course, I did it through a program in Aurora, and it was just an afternoon course. They show you how to do it. You take a little test. And yeah, so it was pretty quick, very affordable too. So.
Great. Joyce, could you talk a little bit about your background in training and education? I know you're an HR director, but it's always interesting to see how people's paths have arrived them at where they are. And you could also as well talk a little bit about training related to CNAs, since you do have a CNA here on the call.
Well, I'm kind of an unorthodox HR director because I have a journalism degree. So in the ad business for over 15, 20 years. And then I jumped into the HR world, just doing recruiting. So you can change your careers multiple times throughout your lifetime. And then I ended up in healthcare. So I was in the high tech market in HR, and then I moved to healthcare. So got to have a flavor of a lot of different industries. But healthcare, I've been with Columbine for 17 years. And I'm excited to have an apprenticeship program that's been very successful for the last 3 years. And so we definitely take on up to 10 students annually for our certified nurse aide program. And we have collectively had a number of all the high schools participating in the PSD school system, and look forward to next year as well. So our group of students do have to go through an application process, and then they do have to go through an interview process to be accepted into the program. And then it starts in the fall when the school year starts.
Great. Angie, could you talk a little bit about your pathway and certifications and degrees that you hold?
So I actually became a medical assistant over 20 years ago when it wasn't really even an official title. So I went through an educational training program to do that and was certified and worked as a medical assistant while I was going to college. So my undergrad is in healthcare administration and management, and my master's degree is actually in organizational leadership. And so I started on the clinic side, and I moved into education through a very large health system. And my job was to actually implement complex healthcare policies from the national government and do the implementation and rollout of those programs. So it was a little bit of a non-traditional path too. I eventually moved into higher education, where I am now at Front Range Community College. So I run the medical assisting program, which is a 2-semester program, and students can enroll in that program through concurrent enrollment while they're still in high school. And we also have students who are just traditional college students who are enrolled in those programs as well. That program is starting next academic year, it's a 26 credit program. And I also run the phlebotomy program, which starting next academic year is actually going down to a 5 credit program. And right now, high school students can't enroll in the phlebotomy program unless they're 18, but that is going to change next fall. So that's a program that students are going to have access to younger than 18 starting next fall.
Wonderful, thank you. And Terry, could you talk a little bit about your pathway to where you are now and different roles and certifications and degrees that you hold as well?
Thanks, Susan. You did say Terry, right?
I did, yep.
Well, I'm a little bit like the Columbine Health. I'm sorry, I've lost your name.
Joyce.
Joyce, yeah. Lots of different pathways in my life. I first became a teacher in education in Colorado in K-12 schools and started doing that. And then after that, I got work for the Colorado Department of Education doing consulting. And then I also got my job at Salud Family Health Centers. And I have no medical background, but they needed education and training, support and help. So I don't fit the medical role really in my career, but education-wise, I do. And one of the biggest things that my training and certifications helped me do at Salud was develop a career ladder program so that entry-level employees have a pathway to other certifications and raises and things like that. So, and then we started the school because we needed medical assistants that are trained in our clinics in the communities where they live. So that's our biggest goal.
Great, thank you. Next question I'd like to ask, and we'll start with Desiree, is could you talk a little bit about what a typical day as an MA at Salud looks like for you?
Well, so now it's a little different since COVID and everything, but usually a typical day is we come in, you clock in, you get ready, you start preparing all your stuff for the day, check to see which provider you're going to be working with in which pod. So which a pod is just a little group of desks and rooms so that you know where you're going to be rooming all your patients. And right away, patients are already starting to come in at 7:40. So we start rooming everybody, getting their vitals, getting them all ready for the provider, setting up procedures, and then doing everything the provider needs us to do, such as giving vaccines to people, drawing their blood, doing their lab work, and then getting them to their next steps, which could be setting up an appointment, getting them ready for a different referral or anything they need. We do that. We need to answer phone calls, help patients in any way that we can. That's typically the day through right now, yeah. So that's about it.
Great. Jordan, same question to you. What does a typical day look like for you as a CNA? And if you want to kind of talk about what your day looks like as a student and then coming to your apprenticeship every day, kind of how you balance your day, and as well as what you do there at Columbine.
So the student part of it, I just go to class as normal. I get out around 12:30, and then I take my break in between work and school. I come into work about 2 o'clock. I clock in. I go look at the daily schedule, and that just tells me where I'm going to be working that day. Then I'll go to my assigned hall. I'll grab report from the previous shift. I work the evening shift, so I'll grab report from the day shift. And then after that, I will round on all my residents, make sure I know where they are, make sure I know that they have everything they need. After that, it's pretty routine. The only big thing there, I have to help get everybody up for dinner, and I have to make sure everybody can get up and get down to the dining room. After that, after we get everybody down from the dining room, we will start helping everybody that needs help to get to sleep.
Great. Angie, would you mind talking a little bit about different settings that MAs interact in, and different types of clinics or different types of medical settings that you find medical assisting students from Front Range go on to do?
Yeah, so medical assistants work in a variety of different settings. Most of them are clinic-based, so they can work in any type of specialty, family practice, pediatrics, urgent care, occupational medicine, you name it. If there's a doctor in a clinic, they probably have a medical assistant working there or more. A handful of medical assistants also will work in the hospital system, working on the floors, taking vitals for patients to kind of help in that capacity. And then we have medical assistants who kind of divide their time, whether they want to be a clinical-based medical assistant. Some positions are more hands-on in patient care, and those are the ones that you see when you go to the doctor. And some of them are more administrative, so they spend less time with patients, and maybe they do things like insurance referrals, or they work at the front registration desk or something like that. So it's all across the board, and I really think that one of the unique things about medical assisting is the ability to kind of find a specialty that interests you most and kind of specialize down in that. And then when you get tired of it, you can go work in a different setting and you have the skills to start in that and learn new skills. So for example, one of our sets of students from this last semester, we have a student who accepted a position working at a urologist's office. And that urologist's office, they've taught her how to do instill chemotherapy into the bladder, which has been a really neat experience for her, and do bladder ultrasounds in clinic. And so depending on where you're at in the specialty, you get to kind of learn some very specific or unique skills to that setting where you may not have gotten to do that in family practice or something like that.
Wonderful. Terry, could you kind of talk a little bit also about the different roles that you see MAs play within Salud, the different tasks they fulfill?
Sure. Yeah, there's a lot of pathways. That's a great question. So of course you start out as a medical assistant and, you know, getting into blood and urine and things like that. And if you really love your job at a place like Salud, first of all, you can live and work in the community where you live, and that's really helpful to a lot of people. But then moving up in the organization means that you could take your pathway over to OB and become an OB coordinator if you really like the world of babies. And then lab leads, we have lab leads. And then if you like the world of lab work and things like that, that's another step you could take. And then care coordination is another step where a lot of patients need, you know, community resources, not just their, you know, strep throat or whatever they might have, but they need some other community resources. You could go for that kind of a job. We have medical assistants at Salud that start out working with a provider and end up falling in love with their clinic and the whole medical staff, and they become center managers. So they help run the whole center and develop schedules and things like that. There's just a multitude of jobs, especially at a community health center like Salud or Sunrise Community Health, which is in Weld County, and that we work with. So there's a lot of opportunities for advancement within the organization. And of course, there's always the administration building. If you get to where you want to work in admin instead of on the floor in the clinic, and there's a lot of jobs there too, because we need the expertise of certain skill sets, but we need that medical background that you get when you're a medical assistant.
Wonderful. Thank you. Joyce, you know, from the CNA aspect, could you talk a little bit about what you see CNAs doing and what their key role is in your organization, as well as what you've seen CNAs go on to do as they advance in their career, if they choose to do so?
Sure. Jordan can speak to a lot of the activities of daily life is what he was describing with his day. But they're obviously, CNAs are really our point of contact with our customers, our residents, and they really do spend quite a bit of quality time with them. So they really can get a good understanding of how the resident's doing. And then that communication can flow to the nursing staff. So they have a lot of direct communication with the nurses to say, hey, this is what I'm observing. I'm not there to assess, but I am observing these kind of behaviors or medical that I'm concerned about. And so then the nursing staff can go in and make assessments and make change. So they are the eyes and ears mostly for the residents if they're non-communicative. And if they are communicating, they really do a good job of communicating to the nursing staff. They also get to watch the physical therapy and occupational therapists and speech therapists do their trade and be able to expose themselves to that interest. And I would say that the apprenticeship program that we have is able to allow our apprentice to go and experience time in all of our operational departments. So they get to sit with the social work team, the admissions team, the maintenance superintendent of the building, to the administrator, and really see the whole look and feel of what a long-term care facility or a rehab center is actually doing as a business. So it really does give insight to maybe I don't want to be a nurse after all, and maybe I want to go to PT school or OT to school. I do have an apprentice right now that she is actually moving into the medical assisting role because she sees that as something that she wants to do versus going into nursing. Every day is a different day, and obviously COVID has really changed and making sure infection prevention is there. So educating our staff about that has been forefront, and I think the CNAs are doing a great job of keeping themselves safe as well as our residents safe, and they're seeing a lot more protocols in place and understanding the medical dynamics of a changing society like we have.
We do have a question that has come into the chat box. The question is, if a student is eventually wanting to get a BSN and maybe a master's or doctorate much later, is it best to start with an MA medical assisting or CNA certified nursing assistant in high school?
I'll open that for Terry or Angie or Joyce, because I know there's lots of different ways to get where you want to go.
I will take my horn on the CNA role because it does give you a sense of what a patient actually goes through, because you're taking care of them as a CNA, and you really do see that relationship build. And if you have that skill level and customer service and listening skills, it really does pay off in big dividends. Even if you want to be a physician or any other occupation, I think that direct touch and communication with the customer, the resident or the patient is value with the CNA role.
And I'll add that I think and especially while you're in high school, really working with your counselor to see what your schedule can support and finding a program that works with your high school schedule, anything that gets you into patient care, where you're actually seeing and dealing with and learning those skills and interacting with patients, I think is going to be a benefit if you're wanting to go on to be a provider like a PA or a nurse practitioner or doctor, whichever path you choose. I really think it from the high school standpoint, whatever you do that gets you in front of a patient is the best thing that you can do.
This is Terry, and I think I agree with Angie and Joyce that just getting with the patient, being on the medical scene will help you, but first of all, also explore your interests. And I think the programs look highly on any participation that you might have with a clinic or a hospital or something like that. I do want to say that if you chose a community health center like Salud Family Health Centers, that we provide integrated care. So that means you'd have on your team and daily interactions with and rubbing elbows with a behavioral health specialist, a dental team and the dentist, as well as the medical doctors and physician assistants, because we provide that full patient-centered medical home. So you get to experience the whole team, and that might help you also make some of your own personal decisions about the pathway you want to go in the medical field.
And as a follow-up question from the chat box, specifically to Jordan and Desiree, did you specifically choose one or the other for a specific reason?
So I actually did a CNA back in high school when I was a senior, and me personally, I didn't feel like I fit in that role of the lifestyle of the CNA, because it's different. They do different roles, they do different patient care, and I felt like that just wasn't for me. And then I tried going to different schools, seeing what was best, and then when I did the NEMA program a few years later, I found out that I actually I like being in the medical field, but I just needed a different course, if that makes sense. So the MA is what I kind of got into.
Jordan, do you want to
So-
talk? Yep, go ahead.
I was really looking into being a CNA in high school. I first found the apprenticeship program because my mom showed it to me actually, and she knew I wanted to get into the medical field, and so I started, following up with that, asking some questions. I think the CNA program was a really good way to get a good bit of the healthcare side of the world. You really get to see what nursing is like, especially in a nursing home. You get to see that side of the thing, or that side of it. You work hand in hand with the RNs and the charge nurses here, and you get to learn how to report to your nurses. What you're seeing with the residents, if anything new is going on, behavioral or physical. And I just wanted to see if this side of the nursing or this side of the medical world was what I wanted to do. And that's sort of why I became a CNA.
Wonderful. We've touched on it. Definitely everybody's mentioned it in some form or fashion. I'm hearing collaboration. I'm hearing the word communication. Aside from those important degrees and certifications that are required to be in these different roles, what are those soft skills? What are those essential skills that either you as an employer or you as someone that helps connect students to those opportunities, or you in that role, Jordan and Desiree, what are those essential skills that really make you successful in your role? Desiree, would you like to start that one off for us?
Sure. So I definitely think some of communication and being very caring. I find that lots of patients, they always tell me oh, thank you, you're so nice to me. Not lots of people are very nice when I come in here, and being a friendly face to those patients as they come in is really helpful. It brightens up their day if they're having a bad one, and you're just there to help them and they know that you care. So that's definitely a big one, I feel like.
Great. Jordan?
So yeah, communication is really important between your residents and between your coworkers. Another big one for me, I'd say, is time management. I think that is one of the biggest skills that you'll need to have when you're working here, because it's so fast paced, and if you do something slowly or wrong and you have to redo it, that could set you off course for the rest of the night or for the rest of the evening. And so, yeah, I'd say time management is definitely one of the biggest skills that I've had to sort of adapt to when I started working here.
And just to keep you on the same screen, Joyce, would you like to comment on what are those essential skills that you're looking for when you're hiring for Columbine?
Yeah, for the direct healthcare worker, Jordan really did hit the nail on the head with the time management piece. And I think that high school students are very talented now. They're doing a lot of different things, and especially in the virtual world, you are having to acquire those skills much better because you're very much more independent. So the team collaboration is really, really important. Communication and how you are respectful to each other in the workplace. And I do think that emotions get challenged in healthcare overall. And obviously with COVID, I think people are learning how to adjust and keep their mental model in a positive way with our customers, our residents. That is really key to us. Obviously, we ask questions like, do you have any direct stories or relationships working with the elderly, or your experience with your grandparents or family and friends? And how do you feel comfortable with them? So those are the good questions that we ask, and the good stories that we want to hear from our candidates, that they are interested in working with the elderly. And then good communication and just the mental model of working in healthcare today.
Would anyone else like to add on those essential skills that are necessary for a clinical healthcare role?
I would, thank you. For medical assistants working in community health centers, which is the primary care setting, communication and being able to collaborate on a team, and Desiree I know you spoke to this, but she could probably elaborate. The medical assistant in a community health center is really the hub of the wheel. That's what we like to call it, because the MA is the first person who interacts with the patient and then is with that patient throughout the whole visit. And you develop a strong relationship with each patient because that's on your, what we call the panel of your patients. And so you develop a long-term relationship because they come in again and again for a medical visit. And so those soft skills of being able to communicate. And the other thing we ask our medical assistants to do is health coaching. So you really need to understand your field and be able to identify, maybe I need to talk to this patient about their weight, or ask the provider to talk to the patient about their weight or their mental health and things like that. So being able to see red flags and feel comfortable having conversations with patients and or the provider, letting them know what's going on. Thanks.
And I'll just kind of add one last thing. I think that I always tell my students, when I was a practice manager, I never had to let an employee go or fire an employee because they couldn't learn a skill. We could always retrain skills like, how to draw blood or give an injection or any of those hands-on skills. I did because of soft skills. If they couldn't meet those communication standards and showing up to work on time and care and compassion, those were the things that employees were let go for if they couldn't do.
Thank you.
So we have some questions in the chat box, and one specifically for Angie. The question is, what specific courses would you recommend if interested in a nursing pathway?
So I would say if you are interested in nursing, specifically, you want to become a registered nurse, the classes that I would be looking to make sure I took in high school would be a medical terminology class. Any of them would be fine, because language is really the foundation of understanding everything that happens in healthcare. So if you can take a language class, which is what medical terminology is, that's huge. That will get you a long way to understanding a lot of your courses. The other class that if you're specifically looking at nursing, I would consider taking is Bio 106, which is an introduction to anatomy and physiology class, because that's the class that all nursing programs require you to take anatomy and physiology. And those classes have a high attrition rate, which means they have a high fail rate. Students struggle in those classes, those anatomy and physiology classes that are required for nursing programs. So taking an introduction to anatomy and physiology like Bio 106 is a huge help to passing those classes the first time you take them.
Okay, and another question is, if your overall goal is to be a PA or an NP, what do you think is the best route to take?
I can give a little bit of insight on that too, just so you know that a physician assistant is a program where you do a 4-year undergraduate in anything. It could be in journalism, it could be in anything. You will have healthcare or science prerequisites that you have to do for that, and then you apply to PA school. A nurse practitioner is a different path to that. So that means that you have to do a nursing program, a BSN and a bachelor's in nursing program, and then do your master's in nursing to become a nurse practitioner. So it's a different pathway to get there. And the first thing that you would need to do is decide which pathway do you want to take. And then if you're kind of looking for classes in high school, really, again, any healthcare related program, so CNA, medical assisting, anything like that that's going to get you in front of patients is going to be a huge help to getting through those programs and being successful in your career.
And another question is, would biochem be an easier choice than individual biology or chemistry?
I'll answer that from the healthcare, from the college side too. No, You really want to take classes that you are prepared to take and you have the foundational knowledge. Sometimes taking those classes separate, like a biology class and a chemistry class, really lets your brain divide that thinking and you be more successful in high school doing those classes.
And another question from the chat box, if a student is interested in becoming an EMT, what types of classes would be needed and what types of programs would you suggest?
I think that one's going to fall to me too. You have to be 18 years old to do the EMS program or EMT program at any college or institution. So you can't do it while you're in high school. If you're 17 or 16 years old, you have to be 18. You would start with an EMS program, and that's a 1-semester program. So there's really not a lot of prep that you would need to do for that. But again, MedTerm is a great foundational class for any healthcare program.
We are getting close to the end of time. We do wrap up this meeting a little bit early so that we can move on to our final chat that we have with another audience. But I do want to just have everyone quickly address kind of what's the best thing about your job, and what's something that's challenging about your role. And let's start with Jordan.
All right, so I can say without a doubt the best thing by far with my job is communicating with my coworkers, with the residents. You know, everyone has a different personality. It's just kind of fun to see who everybody is. Worst part of my job is probably, you know, letting go of people passing away. That never gets easy, no matter how many times you see it. There are several different ways to cope with it, but that's definitely the hardest part about it.
And Desiree.
So probably the funnest or easiest thing about my job, I definitely say, like, personally for me, I love drawing blood. I think it's so fun. It's fun to figure out what tests they need and how much they're gonna need. Trying to get those harder sticks on people. That's always fun. And then definitely the hardest thing is to learn how to not take things too hard. So, you know, you do get upset patients, you will get upset providers. You just have to realize, you know, it's a hard, stressful time right now. They let it go, and you got to keep working to get your patients their care.
Going to Terry, what would you say is the best part of your job and something that's challenging in your role?
The best part of my job is seeing, to be honest, seeing young people come in and choose the medical field, and start a program and just fall in love with patients and the whole scene of being in medicine. And having access to education and employment opportunities that might not have ever existed in their communities. For me, that's really one of the best things. And also, I work to bring on health centers who want to host students as medical assistants, and they're always very excited to start the program. And the biggest challenge is, I don't know, just keeping up, especially during COVID.
Lots of changes that change every day, every hour, I'm sure.
Yeah.
Over to Joyce. What would you say your favorite thing about your role is, as well as what's challenging?
Spending time with Jordan. He rocks. It's just fun to see all the students in high school not too sure about what direction they want to be going in, going through the actual curriculum and learning, and then actually applying those skills that they learn in the lecture and the lab environment, and actually getting to experience that with our residents. I think that's just amazing. And then it's kind of fun because then they come back full circle. And I love that they get a paycheck. So our apprenticeships are very much paid for the work that you're doing. And so the success of the student is that they actually are earning money while they're going to school. And that's always fun to hear where they spent their money or saved their money for the first paycheck. But obviously, as an HR director, I'm looking for the future healthcare workers of the world. And so apprenticeships and a student market is just where I'm at. And I like to see the success that they are making for themselves.
Wonderful. And last but not least, Angie, you're welcome to talk about any of the roles that you've had as leading up to where you are at Farm Range, or talk about your current role. What do you love and what's challenging?
I'll start with what's challenging, and I'll think back to the time when I was working with patients in clinic and kind of in that healthcare role. And I think the most challenging thing that at that time was really you had some difficult days. Some days are really hard in clinic, and you may have patients who are kind of upset with you, or really not with you, but they're upset with everything. And you may have days where you're seeing just a ton of patients, and those are just really challenging days. But on the flip side of that is when you are done with those days, you kind of leave it all at the door, and you get to go home, and you don't bring your work home with you as a medical assistant. You don't kind of have to continually check back in. When you're at work, you get to do your job and you get to do it well. And when you are have those challenging days, you get to leave it at the door. And I kind of really sometimes appreciate that from that clinical aspect of care way back when. I think biggest successes now really are seeing students and helping students who are struggling, maybe getting through or completing their program, and seeing them succeed at the end. Because for the most part, our students do, and I think that's fantastic. You get to see them overcome their challenges and finish their programs and be successful and move into something that they've worked so hard to do.
Wonderful. Thank you so much. To all of our panelists, I want to thank you so much for being here with us today, and all the volunteers on the committee that worked to help put this event together. All of you audience members can see there in the chat some information. There is information about where you can go for further questions. This recording of this chat will be on nocohealthsector.org, and we would love to have you take just a quick minute to fill out a really fast survey to let us know about this event. This is our first time doing it, and we'd love your feedback so that we can improve for the next one. I do see a great message in the chat from about brighter futures and an opportunity there in Weld County for you to get some experience now as a high school student. Let's see. Any last minute questions or anything that burning questions that you'd like to ask real quick, students, before we sign off? All right. Thank you, everybody, so much, and have a wonderful day. And we hope that you had a great experience today and learned a lot about all the different opportunities that you have now as a high school student to get involved in a medical career, as well as opportunities in the future as you move through your career. Thanks. Have a great day.
Thank you.
Thank you.